Good morning. My name is Zelda Epperson, and I am currently a Doctor of Nursing Practice student at Arkansas State University. Dr. Todd Hammon is my program chair and mentor for this project, and the title of my presentation is A Comparative and Cost-Benefit Analysis, Vancomycin versus Ancef use in Total Knee Arthroplasties. A little background information for this presentation begins with a definition of total knee arthroplasty. This is a procedure to replace the joint in the knee and is the definitive treatment for osteoarthritis of the knee. Although our infection rates have decreased in the last decade, total joint infections are a complication from this procedure and can be a massive expenditure on healthcare. Costs can be anywhere from $19,000 to $68,000. This project is based on determining the correct preoperative antibiotic to prevent these infections and potentially save thousands of dollars for healthcare and patients. The methodology consisted of a retrospective review of 1,661 total knee arthroplasties from 2 rural hospitals within the Mississippi River Delta. A random sample number generator was used to generate a random list of integers as a comprehensive version. The sample size calculator was utilized to obtain a sample of 313 based on a 95% confidence level with a margin error of 5%. A Pearson's correlation was used to determine a relationship between the antibiotics and the comorbidities, obesity, smoking, diabetes, recent hospitalization, and previous methicillin-resistant Staphylococcus aureus infections. A two-tailed paired t-test was also used to compare the usages of vancomycin and Ancef with readmissions related to the TKA infections. The Shapiro-Wilks test was used to test for a normality in the distribution, and the Wilcoxon-signed rank test was used to compare the comorbidities related to the readmissions related to TKA infections. The results showed no significant findings with the Pearson's correlations related to the comorbidities tested against each antibiotic, vancomycin, and Ancef. A normal distribution was not found with the Shapiro-Wilks test. Therefore, a Wilcoxon-signed rank test was performed in order to reject the null hypothesis that there was no relationship found between the readmission related to the TKA infection and the comorbidities tested. The null hypothesis was not rejected for the recent hospitalization and the readmission related to the TKA infections. Cost savings associated with this study was related to Ancef being the policy-driven antibiotic to be given preoperatively. All of the documented infections in this study received Ancef preoperatively instead of a vancomycin as the initial antibiotic. This study showed similarities with other studies in that there were no correlations between the readmissions related to TKA infections and comorbidities. There were 5 documented deep tissue infections over the course of the 5 years of total knee arthroplasties. Each infection cost approximately $47,000 when you factor in the readmission, the length of stay at the hospital, the cost of care, cost of antibiotics, laboratory testing, additional surgical procedures for possible incisional and drainage of the infected knee, removal of hardware, replacement of hardware, and any additional care. Ancef cost the hospitals approximately $3.31 per gram, and vancomycin cost approximately $15.01 per gram, an additional $3,661 over the course of 5 years for the addition of vancomycin would potentially save the hospital $235,290 over the course of 5 years. That is a substantial savings. This chart shows a breakdown of the antibiotic cost and the breakdown of the infection cost per year. The limitations of this study was the cohort was based on only deep tissue infections, as this is all the infection control for the small hospitals track, and not the superficial infections or the cellulitis that may have also been reported to other hospitals. Another limitation is that the hospital is not able to track possible infections from patients that may have reported to a different facility. This study was also not generalizable due to the small sample size. Additional studies would be necessary with a much larger sample size to obtain accurate results. The implications from this study include updating our current guidelines with current information on the correct antibiotic dosage and administration as microbes change. Cost savings for the entire healthcare system is also an implication, as the cost of healthcare impacts everyone on some level, from the provider all the way down to the patient. These are the references that I used to complete the study. And thank you very much for your time. Any questions?